How do psychiatrists or nurse practitioners decide which medications to prescribe for their patients? Hey, what's up guys, it's me, the Psych and David C. A lot of people think prescribing psych medication is like random, like basically we just choose one, or like we choose whichever is the strongest, or like whichever is the newest, but that's actually not how it works. There's actually so many different factors that we have to consider when we pick a medication for our patients. So in this video, I'm going to walk you through what psych providers actually look at when choosing a medication. Let's talk about it.
This video is for educational purposes only and is not meant to be medical advice.
The first thing is the diagnosis. After the patient tells us what's going on, their story, their history and all that, we have to pick a diagnosis. And there's like hundreds of diagnoses. A lot of them can be similar too, like there's major depressive disorder, but that's different from bipolar depression. Or there's generalized anxiety disorder, but that's different from panic disorder. And a lot of people complain of symptoms of ADHD, but they might not actually have ADHD. So if the diagnosis is wrong, then the medication choice is probably going to be wrong too. For example, if a provider diagnoses a patient with major depressive disorder and they start them on an antidepressant, but it turns out the patient is actually bipolar, the antidepressant could actually cause that patient to go into a manic state. If a provider diagnoses a patient with ADHD, but it's actually just anxiety, and they prescribe them a stimulant like Adderall, that's just going to make their anxiety worse. So it's very important that the provider gets the diagnosis right so they can choose the right medication for that diagnosis. And then next up is the severity of symptoms. For example, with major depressive disorder, it can vary from like mild to moderate to severe. I've even had some patients come in who I don't think they need medications at all, like they maybe just need therapy. And then on the other side of things, I've had patients come in where outpatient telehealth isn't appropriate because their symptoms are so severe, but most of them are in between those two. I'll have to ask, like, is the patient functioning? Are they sleeping? Are they working? Are they able to go to school? Are they psychotic? Are they having suicidal thoughts? So basically, depending on how bad their symptoms are, it does make a difference on which medications we want to prescribe. And then next up is medical history. Now this can include things like high blood pressure, diabetes, hyperlipidemia, seizure disorder. There's like so many different medical conditions that can actually affect medication choice. One example is that if a patient has a history of seizures, then we definitely want to avoid prescribing bupropion or Wellbutrin because that medication can actually lower the seizure threshold. Or if a patient has high blood pressure, we want to avoid SNRIs, which is a class of antidepressants, because that class actually increases blood pressure. Or if a patient's pregnant or intending on becoming pregnant, we want to avoid medications that could possibly affect the baby. There's basically a lot of medical conditions where, like, if the patient has it, then we definitely can't prescribe this medication. And then we also look at side effects and patient priorities. Patients are definitely going to differ on which side effects they're most concerned about. For example, the most common class of antidepressants are SSRIs, and one of their major side effects is decreased libido. I've had a lot of patients tell me like they don't want to take that class of antidepressants because they just can't handle having the decreased libido, and I don't blame them at all for that. So even though I may think an SSRI is the best choice for their situation, if they're really concerned about that certain side effect, then I would go with something else that doesn't have that side effect. And there's a lot of other side effects that patients are concerned about, like weight gain, sedation, or even diarrhea. There are certain medications that treat the same diagnosis and the same symptoms, but they have different side effect profiles. Depending on what the patient values, the side effects can be a big factor when we choose psych meds. And another thing we look at is past medication history. If a medication worked for a patient in the past, it's probably going to work for them again. So that's why we always ask, like, what psych meds have you tried before? What dose were you on? How long were you on it for? What happened that made you stop taking it? And basically, did it work for you? If a patient says that this medication worked for them in the past, there's like no real reason not to just restart that medication. If it ain't broke, don't fix it. And on the other side of things, if a medication did not work for them in the past, then we definitely want to avoid trying that medication again. And also sometimes family history of medications can guide our decisions too. Like if a medication worked for a patient's mother, then we're probably going to try it out for that patient too. And another thing we look at is medication interactions. This matters a lot, especially with patients who are taking multiple medications, because there's so many potential drug interactions that we have to make sure everything is safe. And this doesn't just apply to medications, it also applies to over-the-counter supplements too. For example, if a patient is taking St. John's wort, which is a supplement for depression, they generally shouldn't be started on an antidepressant because it can actually lead to serotonin syndrome, which can be life-threatening. So we always make sure that any medications we prescribe don't have any negative interactions with any medications that the patient is currently taking. And another thing we look at is substance use risk. These are things like alcohol use, drug use, or even past history of misusing psych meds. There's a class of psych meds called benzodiazepines that are used for anxiety, but actually come with the high risk of misuse and dependence. So if a patient has misused benzodiazepines before, then they probably shouldn't be started on benzodiazepines again. Then the same thing applies to like stimulant abuse. If a patient has a history of misusing Adderall, it's probably not a good idea to give them Adderall. Like, yeah, the benefits of these medications can be really good, but sometimes the risk of misuse is so high that it's just not a good idea to prescribe them. And another factor is the time to effect. Not all medications work at the same speed. Some are fast acting, some are intermediate acting, some are short acting. Some medications work within hours or even minutes, and other medications can take like weeks or months to kick in, so it really depends on the situation. A really common example is a patient who complains of like overwhelming anxiety. Now, even though antidepressants are called antidepressants, they actually work for depression and anxiety, but they don't start working until like at least 4 weeks in. So it's a very common practice to like start the patient on an antidepressant and a fast-acting anxiety medication at the same time. So while that patient is taking the antidepressant every day to let it build up in their system, they can take the short-acting anxiety medication in the meantime. And the goal is that once that antidepressant kicks in, the patient won't need the fast-acting anxiety medication anymore. So we definitely look at the time it takes for medications to start working. We balance short-term relief with long-term stability. Another thing we look at is cost and access. There are certain medications that cost a stupid amount of money, like most insurances won't cover it, and it would literally cost like thousands of dollars to get that medication. Obviously, that medication isn't gonna be our first choice, because even if it is like technically the best medication for the patient at the time, if they can't pick it up, then there's no point. So generally we try to start with like the cheapest generic version of a medication just to keep the cost down for the patients. And another thing we look at is simplicity and adherence. There's medications that you only have to take once a day, but there's also medications that you need to take at least 2 or 3 times a day for them to work. If there's a patient that struggles to remember to take their meds, it's probably not a good idea to prescribe the medication that needs to be taken multiple times per day. Generally, we always try to prescribe the medications that you have to take the least amount of times per day. It's a lot easier and more convenient if you only have to take your meds once per day. And then maybe the most important factor we consider is shared decision making. Honestly, prescribing shouldn't be like, here, take this drug once a day and I'll see you in a month. It should be more like, here are your options, here are the risks and benefits of each option, here's what I recommend, but what do you think based on all the information that we have? Patients should always be a part of the decision-making process. So that wraps it up for what psych providers look at when prescribing a medication. As you can see, it's a lot of different factors that we have to take into consideration, but it shouldn't just be what we think, it should be what the patient thinks is best for them as well. If you have any questions, feel free to leave a comment down below. If you found this video helpful, make sure to like and subscribe. I do videos on psych stuff twice a week. I am also on TikTok and Instagram if you want to follow me over there at the Psych MP David C. I do telehealth medication management for adults living in California. If you're interested in booking with me, there's a link down below. And with that, your mental health just leveled up. You're welcome.